Hello, everybody. Welcome to today's webinar on RHC grant funding, on how to close out that RHC grant confidence grant that Elizabeth Burrows helped most of you guys obtain. And I'm sure that's why you're on this webinar. If you're here, it's because you got that grant and you have no idea what you need to do by June 30th. So Elizabeth Burrows is here today, and Jerry Hoffer is here as well. He's with Target Continuum, and they are going to tell us what you guys need to do. Not sure how long this will take. I'm thinking maybe 30, 40 minutes or so, but they're going to tell us. This is my contact information. My name's Mark Lynn. I'm a CPA from Chattanooga, Tennessee, and Danny Gilbert is with us as well with Healthcare Business Specialist. She'll be able to help you with any technical questions you have on hearing or slides. The slides are in your handouts, by the way, if you want to get your hands on those. Here is what we do. By now, y'all had enough of these lunch and learns where you know what we do. Elizabeth and Jerry, when you guys get on, why don't you tell a little bit about what you guys do? Because I know, Elizabeth, I think you do a lot more than what I thought you did from I forget where I saw it the other day, but I was like, oh, wow, Elizabeth she's really doing a lot. So let the people know what you guys are doing so we can get resources out to these rural providers. It's funny, and our client base is so rural. I was doing a cost report yesterday. One of the cost centers was telephone and telegraph. So apparently we're only about 100 years behind on technology there. So some RHC somewhere has a telegraph apparently. But there's our Facebook group, the RHC Information Exchange. There's about 3,600 of you guys on there now. Thank you for contributing to it, answering questions and asking questions and being very, very interactive with the Rural Health Clinic community. So we appreciate that. Questions, if you want to type those in, you're more than welcome to, and Danny will ask that to Jerry and Elizabeth at the end of their time. And if you want to, we can open up your line and you can ask a question that way as well. So we'll have a little bit of time to ask questions for that. Disclaimer, I'm assuming everything is up to date as of today. I didn't really have anything to do with the content of this session, but I know Elizabeth and Jerry probably checked all the resources up to the last second for this. So, and the session is being recorded. If that becomes an issue for you, just hang up, because it's going to be recorded. It will be put on YouTube, and we will have links to it in the Facebook group and on our website as well. Elizabeth's presentation is on our website already, and like I said before, the two presentations, the administrative presentation, this one, and Elizabeth's is in your handouts over there on the side as well. If the handout doesn't download, go to Webinar Hates Me, and half of the things I put over there, it will not download, but it is on our website as of this moment, and it is on our Facebook group as of now as well. There is Elizabeth. She's from Indiana, very proud of being from rural Indiana, and why shouldn't she be? Indiana's a great place. I go there a lot on business. And she's a lawyer. She's worked with FQHC. She's done grant funding. She's done so much stuff and is so daggum smart and so helpful and very available to our clients. So we're very appreciative of her. If you need to get a hold of her contact information, here is how to get a hold of Elizabeth. And her company is Burrows Consulting, and it's growing like weeds, which means they're doing fantastic work for everybody. And without further ado, I am going to turn this over, and I hope I get the right Elizabeth, because y'all are both, Jerry and Elizabeth, y'all are both signed under the same one. Hopefully I picked the right Elizabeth Burrows. Are you in control, Elizabeth?
It came to me.
It came to Jerry.
Jerry, if you want to do it, that's fine. You can run the slides. That's fine with me.
Well, hang on.
or you can put it back to me. So I just want you to know, a lot of you have money, and after about the third or fourth call and email I received where people said, hey, Elizabeth, thanks for getting me that grant, but now I have that money and I haven't spent it and I haven't got everything together with it. So that is where I come in, and I'm going to be here to help you. If you want to scroll up, Jerry, to get started there, that'd be great. To slide 1.
If you do slideshow from beginning, it should populate the whole screen.
Slideshow from beginning. Perfect. Okay. So after 3 or 4 of you contacted me, I reached out to Mark and I said, hey, maybe we should do a webinar about getting these grants closed out and making sure that people use that appropriately. So first of all, if you're on this call, it means probably that you received a rural health clinic vaccine confidence grant. So first of all, congratulations. These are the first set of its kind that went out to rural health clinics. Jerry, are you able to get it going? Are you working on it?
Yeah, so I probably should change this over to you, to be honest with you.
Okay.
Yeah, let's do that. Let's try this. Let me try it one more time.
I got it.
Okay, you got it?
Switched it over, Mark.
Okay, thank you, Danny.
Okay. And so anyway, how do we close this thing out? How do we get everything going? So congrats on getting the grant. Hopefully you've been able to draw down your money. We're going to talk about that. So the notice of award, first of all, you should have got a notice of award. It would have went to your project director. Make sure you print it out, look at it again or download it again, review the amount, make sure there's any conditions, and look at the budget that you submitted. A couple of you have reached out to ask, hey, I lost my budget. What did I submit? Check that again. Make sure that you have your notice of award in your budget. That's going to be key. Then you can check with your payment management system. The payment management system is the PMS system where you've been drawing down your funds. So you should have a bank account connected. You should be drawing down funds. You can log into that system, and I know it's like a 4-step process to even get logged in. I know the headache, I know the pain, and I know Cassie that works with me has been helping a lot of you on that. So check the payment management system, look at what funds are available. Look at your own grant spreadsheet. Hopefully you've been keeping a spreadsheet for what you've been spending. What have you spent? How much have you drawn down? Look at the PMS system. What money do you have left? Or do you have any left? If you've spent it, great. We're going to talk a little bit more about that. If not, Jerry that's going to present to me may just be your answer, or we can come up with a couple of different answers. Keep in mind, and this has been asked 100 times of me and probably 250 of Mark and Danny. Yes, your expenditures, if you paid me to write your grant, if you paid a staff member through this, anything we're talking about today is allowable on the cost report. These are allowable, these expenditures that you've made. If you're paying Mark to do your cost report, you can pay for that. If you're paying me to help you with grants, yes, those are allowable expenses. And yes, any of the money, even if you spent grant money, that's fine. It's still an allowable expense on your cost report. So you want to have that spreadsheet. You also want the spreadsheet for what you've spent and what you draw down. Okay, I'm going to say this, and I know all of you are going to say, but I got an email, and here's what I'm going to say. If you have funding left, spend your money. This is not a time to be cheap. We're not saving for retirement. We're not trying to save money for our kids' college fund. This is called, you have a grant, spend it. Spend it by June 30th of 2022. Unless your NOA has a different date, which it shouldn't, but always check your notice of award. Whatever is the date of the ending of the notice of award, spend your money. I'm going to say it again. Spend your money. I know you all got emails because a lot of you have forwarded them to me, and I've seen them online, that you can request a no-cost extension. Okay, I'm going to tell you, the no-cost extension request is as much or more work than the actual grant was itself. It's extra paperwork, it's more federal requests, you have to put in a request, then you have to wait on HRSA to approve it, then you have to wait to be able to spend your money, and then you have to do yet another report and two extra quarterly reports and all those things that they don't really tell you. But I'm just gonna say, I'm telling you because I've done no cost extensions. I've learned it the hard way. I learned it when I worked at Indiana Department of Health, and I learned it when I ran RHCs and FQHCs. Do not request a no cost extension. You should have had ways to spend your money. If not, I'm going to tell you, you can get it spent in the next, 48 days. I think I did my math right. I got it CPAs on the phone, so I'll be corrected if not. You can get it spent, let's just say 45 days, so you have a couple days cushion. You can get that spent. Make sure you get it spent so you don't have to request the no cost extension. If you do a no cost extension, again, you have to do a whole new budget for the whole amount. You have to wait on HRSA approval. You have to upload it. You have to wait on their approval. And if you don't know, the electronic handbook where you have to do all this stuff is having a lot of computer issues. I've had 2 clients that have things that aren't working right in the EHB right now. So that's just something to be aware of. It is extra paperwork. You have to have a detailed cover letter. And again, you can't just go ahead and spend them. You have to wait on HRSA approval. So my advice, spend the funds in the next few days, month and a half that you have before June 30th. If you're watching this after June 30th on the recording, you're watching it in July, then go back to your email, look at the instructions for no cost extension. But as long as you're watching it by June 29th, get that money spent. Again, don't do this. We need to show Congress and the president that RHCs need this money. When we ask for no cost extensions, that's telling the federal government, hey, guess what? Really didn't need this. I'll just hold it and save it for a rainy day, right? That's fine. And a lot of times in our life, we want to save money. But this is a time we want to say, we're going to spend all that $49,000 and some change. You didn't think we'd have enough requests for $50,000. We're going to spend $49,000 and change because RHCs need the money and we need it in the future. And I'm telling you this because other grants do spend their money. And if you start doing it, this has happened to a couple people that I work with, not my clients, but people that I know of or have came to me after this and said, at one point, our funding got reduced because we asked for too many no cost extensions. That may not be the case for this RHC deal, but what I'm trying to get at is we want to show Congress and the president that finally recognize rural health clinics and rural health centers that we need the money, we're going to spend it. Is it legal to ask for the no cost extension? Yes. In theory, is it tons of extra work? Do you want to add an extra 20 hours of work that you don't need? No, suspend it. So again, here's some ways, how do I spend my money? First, look at the budget that you submitted, the most recent one, and if it's in the same category, if you can change it. So I'm going to give you an example. Let's say that you put personnel and you put that you were going to pay for a nurse practitioner. For whatever reason, you weren't able to get a nurse practitioner or it was a different person than you said. And instead, you want to use that funding for a nurse. If it's in the same category, that should not be an issue. That is fine. If it's in a different category, you can change up to 25% without federal approval. So let's say that you received the $49,000 and some change. You could spend $24,800 and some odd dollars. Sorry. If you receive $49,000, you could spend $12,000 and some odd $100 in a different category without federal approval if it's less than 25% of your total award. So I'm going to repeat that. If it's in the same category, you should be fine, which means personnel, fringe, other, contractual, etc. If it's in a different category, so let's say that it's in personnel and you want to move it to other to do a contract for billboards or for patient outreach, then you can move up to 12 or up to 25% or about 12,000 if you had just one clinic grant into a different category without federal approval. If you want more than that, more than 25% from one category to another of the total grant, then you have to get federal approval. And yes, you can change your budget completely, and you would reach out to the 2 HRSA contacts that are located on your notice of award. So if you totally want to change the budget, you can do that. And trust me, changing your budget now before June 30th is 100 times easier than changing it on July 1st. and asking for the extension. So I'm going to tell you just some stories. I always like stories. I like to hear stories. Most of the people that I work with love to hear stories. And some things that have been successful. One, is just staffing needs. So people have used it for staffing needs. Of course, that's been a success. I've had a couple people do social media campaigns in relation to vaccines, but also just about their clinic. You're welcome to promote your clinic, to do outreach activities. We have billboards. This is an example of a billboard that someone that I work with did, Freeman Family Practice, and she's allowed me to share this. And again, yes, it does say vaccinate, but it also has her clinic number and clinic information. Maybe you want vaccinate smaller and you want your number bigger. You know, again, this is just an example, but this is your time to promote. I know how rural people are. I'm one of them. Well, I don't need to brag. It's all just fine with me. If people want to use my services, they know me, or people already know what's happening with me. I don't want to go out and brag about myself. Well, guess what? We all know we drive by the highway and we see billboards, so they work for a reason, right? How many lawyers, and I can bash lawyers because I'm one, how many lawyers do we see on billboards every day? How many social media campaigns do we see? People use these because they work. The other thing is I've had some people do school outreach activities, backpack programs, doing education in the schools, and I've heard really, really good things about that. I've had a couple provider-based clinics that had 4 and 5 clinics working with a critical access hospital that used their grant funds to do that. And they really, really had some great success. I wish I had pictures, but I couldn't get pictures from them. People have participated in health fairs. You know, this is your chance. Get signed up for summer fairs. You say, well, it might be after June 30th. Get your money spent. Maybe you have to pre-sign up. Get that money spent. Get these things done. Get your contracts in place so you've got the grant fund spent. You're ready to showcase what you need. So again, really the possibilities with this are endless. So make sure that you think of what you need. I've heard of people doing door hangers, which I know about their clinics. I think that's hard in a rural area, but if you like to walk or your staff likes to walk, that may work as well. So again, there's a lot of different things that you can do with your grant money. Again, vaccination education and engagement efforts. People have put signs in their clinics. People have done, again, notices in backpacks. These are just some of the things that I've heard at any kind of clinic outreach activity. Sometimes the actual rural health clinic has put bounce houses and done little health fairs and activities and screenings and vaccinations right in their parking lots. And these are things, again, that are all allowable. Publicize your clinic. I've had some of you call, and I'm just going to say this, I have my own business. I'm not political, and I'm not trying to get political. I know some of you have been a little nervous because you're saying, hey, a lot of people in my area don't want vaccinations. Trust me, I know. My kids go to a very small school. They know no other kids got the COVID vaccine except for them, they swore, and one other kid in their class. So I get it. But again, this is still do vaccination outreach, but again, promote the heck out of your clinic. One person said they just put, make sure your vaccines are up to date, and did a lot of education around that with their clinic name and the phone number huge. If your clinic numbers are down, and some of you have told me they're up, great. But I have had some of you say, hey, my clinic numbers are down. This is your chance to compete with the big dogs. Use this money, get your clinic name out, grow it, see patients. Hopefully Mark's done your cost report so you get a great rate. With all the new legislation, independent RHCs, this should help you get a better rate. And this is time for you to really use this money to brag about yourself, which is hard for rural to do, and to grow your clinic. And now I'm going to turn it over to my friend Jerry Hoffer to tell you some more things. Honestly, I will warn you, his presentation kind of blows my mind because I don't think this way in terms of outreach, but hopefully you're able to learn about it and some benefits that his company Target Continuum can provide you. So Jerry, I'm going to turn it over to you, but I can keep running the slides.
Excellent. All right. Well, I appreciate that, Mark. Elizabeth, thank you for this opportunity to speak with our group of RHCs. We're excited to have this opportunity. A little bit more about who we are. We're here in Indianapolis suburbs, and we've been helping nonprofits for over 30 years. And honestly, we speak RHC, we speak FQHC, lookalike. We're helping over 600 health centers across the country, helping them with all their outreach and education initiatives. So we understand the conversations that you're having in your communities as we're having similar conversations with other RHCs in their communities. Next slide speaks to, we've got an organization called, part of our organization called the TC Cares Project. It's a philanthropic effort. And our mission is to help ensure that all populations have equitable access to healthcare, education, and ultimately great healthcare. So as a result, our TC Cares project provides things like waived management fees, free commercial CTVs, connected TV ads and display templates, discounted outreach channels, free grant audits, and discounted grant writing. The next slide, we kind of speak to a little bit. I've got a snapshot of notice of funding, and to reinforce what Elizabeth was saying, a lot of these outreach initiatives speak to, with this notice of funding, that a lot of the initiatives are centered around education and outreach. And here in the notice of funding, they suggest several different ways that Elizabeth's already touched on. On the next slide, everything starts with Google. Even in the rural areas, everything starts with Google. Everybody's online. There are 5.6 billion searches every day on Google. It's how everybody finds everything. 1 in 20 of those searches are healthcare related. In reality, it's today's version of the phone book. On the next slide, we reference, on the next slide, it talks a little bit about how digital outreach, digital marketing is extremely transparent, very trackable. There's a lot of different ways that you can reach out to people in your community. The great thing about digital is that we've got the available, it's very transparent, very trackable. We could follow the path of the user from, we show your ad, somebody clicks on your ad and they go to your website and they call you, or they fill out a form, or in some cases, for some health centers, they book an appointment right on your website. That's how trackable and transparent digital can be. Next slide, web presence. Where do we begin? Where do we start? And frankly, a great web presence starts with a great website. Within 50 milliseconds, not very long, is how long it takes a visitor to form an impression about your website. So if your website isn't quite up to snuff, we can help. You can leverage a portion of this grant to fund even things like a website redesign. We're adding landing pages to your website so that you have relevant content. We can add blog pages. We've got teams of writers that write healthcare articles for like blog subscriptions. In the end, your web presence it's really only as good as your website. We could drive tons of people to your website, but you know, if it's not set up properly, maybe nobody's probably ever going to call you. So on the next slide, we reference a few different digital outreach strategies that we would likely be recommending to rural health centers within this group. Okay, so if you have some funding available, our goal is not to just spend your grant dollars. At the end of the day, our goal is to invest your grant funds in the digital outreach and education platform. That's something that will be scalable and will just demonstrate a great return on investment, even without the benefit of having this grant funding, if that kind of makes sense. Our primary digital channels for healthcare, we will suggest, will likely include targeted display, connected TV ads, as well as search networks. The next slide, I talk a little bit about paid Google search. Paid search ads are ads that are triggered by very specific keyword searches in a defined geography. The stuff that comes up at the top of the page that says ad when you search for most anything. They are the text ads. These text ads, you could show them thousands of times, but generally the only time that there's a cost associated with these types of ads is if somebody actually clicks on your ad. So that's why they call it pay-per-click. And by the way, for those of you that are joining in today that are 501c3s, be sure to email me or call me after this meeting and ask us about a $10,000 monthly Google Ad Grant program, as you are likely eligible for that grant. We've got over 600 other centers.
And this will help you compete with the big dogs, because the big hospitals, the big clinic systems are doing this. So this is a way that you can get free online ads to help you, because trust me, other people are paying for it, and I understand you're small, you can't, but I love anything that helps the small guy compete with the big dog.
Yeah, and by the way, if you don't have a philanthropic arm and you're not a 501c3, be sure to talk to Elizabeth, because she might know something about creating a 501c3. Am I right?
You are right. I'm doing that for some of the RHCs right now.
Yeah, there we go. All right, so some of the other ways that will connect with your community: display outreach. Display ads, they appear on millions of websites, family-friendly websites, I might add. They're priced typically on a cost per thousand basis, and they tend to be really effective and can also be highly pinpoint targeted. Next slide, I drill down a little bit more into some of these display targeting tactics. If it were to render, there we go. All right. Sometimes it takes a moment. All good things are worth waiting for. So anyway, the great thing about digital display is all our different targeting options, such as we can hyper target based on geography, such as we can reach out and target people with display ads based on a radius of your health center, based on what zip codes they live in, or cities or counties. We have the ability to show display ads to just your patients. We have a platform, a middleware that can match up IP addresses, your patients' IP addresses, to emails and phone numbers. We're HIPAA certified, so definitely it's HIPAA compliant. Your PHI is safe. It instantly anonymizes your PHI. We can target people that have been to your website recently. We can, with these display ads, we can target people that are new movers in your community. We can run James Bond-esque like campaigns that would be like geofencing people that walk into certain buildings. We have health centers that are like trying to get new employees that are targeting other healthcare organizations, like, let's geofence the hospital so that everybody walks into the hospital is seeing ads about come work for us. We can target based on income, race, age, interests, and more. Like, for example, we're running HIV campaigns where we're targeting just the LGBTQ population. That's how targeted we can get with this. On the next slide, another channel that we recommend on the next slide, we talks a little bit about connected TV. So many people are really kind of cutting the cord with cable TV. In connected TV, roughly 82% of the households have access to connected TV. So people are getting subscriptions to things like Hulu, Netflix, Sling, Roku, right? And you've probably seen some ads on those. So the great thing about connected TV is the targeting. For most health centers, television has really never been a possibility because the TV market's just too darn big and there's far too much waste. The beauty of these types of ads is you tell me what zip codes you service. These ads only target those zip codes. If you tell me we want to reach people in certain income levels, well, then we'll target those income levels or their demographics, race. Again, we've got HIV campaigns where we're serving these ads up to just the LGBTQ population. So Elizabeth, would you do me a favor and right above that remote in your, well, actually, well, hang on a minute here. Yours might not have it.
I was gonna say, I may have pulled up the wrong one, so we may have to try to show it at the end.
Yeah, yeah,
Okay,
so
keep going,
anyway,
and I'll try to pull it at the end, okay?
when we send you these presentations, we create these ads. We've got basically health center ads that we create at no charge for your rural health centers, much like this ad that we will be showing you at a later date. And that link will be in this presentation so you can review some of these connected TV ads. On the next slide, I've got a review. And then this is how we talk about how do we put together what we're going to recommend for your rural health center. So it starts out by, we've got to identify your audience. You have to tell us, who do we want to reach? Are they patients or are they non-patients? What zip codes, what city, what counties? What are their demographics of the people that you're trying to reach? Then we pick out step 2 is we pick out the channels, search, display, connected TV, and many other things that would be most suitable and cost effective and show the best return on investment to reach that audience. So on the bottom left, I've got a sample for that. Something that we put together was the end result, the projected impact that a campaign we had created for another RHC in terms of how many impressions for display ads and connected TV ads, in terms of how many additional website visitors we anticipated that the campaign would generate, and in terms of how many new patients that the campaign would create. Again, we know if we drive 33 people to your website through Google searches, that on average, one of those converts into new patients. We understand all those metrics. So anyway, long story short, in the next slide, we would be happy to put together some recommendations, kind of a marketing outreach education blueprint for your RHC, no cost, an analysis as to if you invested your remaining grant dollars into this program, what we would expect to see in terms of incremental traffic to your website, projected impact also in terms of new patients, and average cost per acquisition, and so forth. Final slide, I've got my contact information, and I'm very thankful that you shared part of your day with us. Feel free to email me or call me with any questions that you might have. If you'd like to see some samples of the connected TV ads or some of the many samples of display ads, I'd be happy to share those with you. That's pretty much all I have. Thanks again for your time.
And just want to elaborate that, yes, you're welcome to use these types of things. This would all be allowable. We want you to spend your money. If nothing else, maybe he gave you some other ideas, but I know when my clinic used Jerry back a long time ago, and they still use Jerry, but when they did, when we used Jerry, what was really exciting for me is you can target certain people. So if your RHC likes serving the Medicare population, there's ways to target them. If you like kids, there's ways to target kids, and so on and so forth. So that is, that's what's exciting to me, is that, you know, you do have the capabilities of doing that. So I'm going to try to pull up the ad, but while we do that, if you have any questions, I think Jerry or I or Mark, I'm sure, are glad to answer those.
Absolutely.
Yeah, thank you guys for doing this. I really do appreciate it. I think I've learned. I wish I'd have met Jerry a long time ago. When I remember when these Google ads first started coming out, and I would go in there and bid on, you know, you put in there how much your bid was per click, And I think I paid thousands and thousands of dollars. I don't know if I ever actually got a a client from that, but I think I was doing it completely wrong. So to have somebody like Jerry that actually knows what they're doing and how to do it, that is the way to go about that. So and I guess, is there time between that? We only have 48 days to spend this money. Is there time to get this done before June 30th to get this? Okay, good.
Yes, because as long as you have your contract in place, that would be set up. Again, this is something too, if you've spent your money, you still want to do it. Again, like Jerry said, he can do the practice analysis. Jerry, I don't know. I'm still not able to play the ad, so I think we'll just have to move forward, and maybe you can send a separate link that Mark can post on his website to get to that, because maybe the embedded ad is acting up. I know sometimes it does, and I use a Mac, so sometimes that happens. But yeah, this is something that you could get your money spent. It's a way to get it done. I know somebody else just signed a billboard contract. They were asking me, I said, well, the money would be spent, so it would meet the requirements of the NOA. So yes, it's money spent. You do have to, so it would be like a pre-purchase in a way, but yes, this is something. And I mean, they could get going right away to get something rocking for June. I know we always pushed ads at my clinics in June because June and July a lot of times are the low months for clinics. So it is a way to expand that. So if there's any questions, we're glad to answer that, or if not, we can give people some time back.
Yeah, well, we do have a question that came in from Dr. Reddy, and I'm working on your cost report, Dr. Reddy, as we speak. So look for that soon. But her question is, I wasn't paying as much attention as I probably should have been to y'all's presentation because of that. But Dr. Reddy is asking, are there any grants available now for independent for-profit RHC? So she's got a for-profit RHC in Louisiana.
No, I don't believe there are right now, and but there should be some coming out from HRSA. There was one that was due last month that independent for-profit RHCs could apply for behavioral health, and we'll keep trying to publicize those as best we can. And I put those out in my newsletter. I know, Dr. Reddy, you're on it. If you're not on it, shoot me an email or go on my website, or email Mark. Mark forwards me stuff about daily questions. So glad to put those out, but right now there are not. I will say, and I can't, I need Mark's crystal ball slide. I will say FQHCs and lookalikes just got a new opportunity that's due the 23rd of May. Last time this happened a year ago, it went to the FQHCs and the FQHC lookalikes, and then the RHCs got an opportunity. Now, I have no idea. That would be a question for Nathan Ball or National Association of Rural Health Clinics, but I am telling you, if you as a grant writer, you always look to the previous year to see if opportunities will be available. Again, the opportunities were available last April and May for FQHCs and lookalikes, same this year. And then in June, it was for RHCs. I have no idea if that'll happen again, but if history repeats itself, that would be very good for you guys. That's why I want you to spend the money now and not ask for extensions, to show, yes, we need it. We need more money again.
All right, next question comes in from Rob. Rob asks, do we enter our expenses on the grant website?
You enter so you actually don't have to enter your expenses anywhere. It's that you keep it in case you're audited. So, but when you're in payment management system, you are putting in how much was spent, how much was already spent. You would put that in the payment management system, and then you have to do it for your FFR, the final report, that will not be available until July 1st. So it's not even available. I know some of you have wrote me, you've wrote HRSA, you've wrote payment management system. The final report is not available till after the grant date is closed out. So that's when you do the final report, but you actually do not upload your spreadsheets or your receipts anywhere. However, if you are selected for an audit, you want to have those available. And by audit, I don't mean audit, I mean a HRSA grant audit. And they were doing financial reviews. Many of you sent your policies and things like that. So make sure to respond, and always check your spam email folders, or some of you have now called it quarantine folders. I picked that up. So if you have a spam or quarantine folder, check it to make sure that you haven't missed submitting something that you should have. Okay. And if it's not from an @HRSA.gov email, it's not right, couple of you had scammers hitting you up for information, wanting your financial information, policies. HRSA should only be asking for policies or for policy attestation. They are not asking for financial reports. If you get asked by somebody claiming they're with HRSA and they do not have an @HRSA.gov email, delete that.
Okay, and if you do have if you want me to open up the line, if you raise your hand, you can do that. While we're waiting, we'll give a couple minutes for people to raise their hand. If you do get an email asking you to pay money, I know we had one I had an email yesterday. Somebody said, I got this email from a company that says, oh, for $200 or $400 or whatever the number was, we will take care of your SAM for you. That's a scam, right?
Correct. It's not really a scam. It's a service they provide, but you don't need to pay to do it. So just go log into SAM and do it yourself. Many of your SAMs will expire on June 30th. The feds are switching from SAM to UEI, Unique Entity Identifier. But so you still want to keep that up to date so you're ready. As Dr. Reddy was pointing out, you want to keep that up to date in case more grants come available. But you should not have to pay for any government registration.
Okay, perfect. Okay. One last look through here, one last chance to raise your hand and ask a question. And I'm not seeing anything, so that's great. All right. Well, Elizabeth, Jerry, Danny, thank you for what you guys do. Everybody go out and take the advice that my wife and daughter have really lived by lately, or really for the most of their life, is spend it now. That's it.
Spend it, spend it, spend it. You know, you can't take it with you, so spend it.
That's it. They have done well. They caught on before you even had to say this. So,
hey, we must all be smart women. That you got a lot of smart women in your life, then, Mark. Telling you the same.
Believe me, I do. Okay. All right. Well, thank y'all. Bye, everybody.
All right, thank you.
Bye. Thank you, Jerry.